Good evening. My name is Dr. Karen Wright. I am the Director of Admissions and Program Evaluation for the George Washington Physician Assistant Program. And I welcome you this evening for joining us in our first official information webinar. Typically, we hold 4 information sessions at the GW campus throughout the academic year, which allow participants to come to the Foggy Bottom campus and learn about the program and ask pertinent questions. But we thought it would be beneficial to offer a forum in the form of a webinar to provide those interested in PA with the opportunity, and those that can't actually attend the campus sessions, an opportunity to learn more about the GWPA program and about the application process. Today I am joined by Erin McCann, our Senior Academic Advisor for the program, as well as 2 of our current students who officially successfully completed their first semester in the Physician Assistant program. Yay! My student to my right is Ms. Celine Cronkrite, who serves as the co-president of the James K. Tolton Society, which is the George Washington University Student Society chapter of the American Academy of Physician Assistants. In addition, Ms. Cronkrite is a what we call a dualer. She is in the MSHS NPH program. And we're also joined by Mr. Daniel Brown, who currently serves on our Student Admissions Committee. We thought it would be beneficial to you if we had students available to respond to any questions that you might have, so that you could get their perspective since they're living the life of a PA student now. Erin at this time will discuss the format and any of the logistics with regard to the webinar, and then I will start the presentation by providing you an overview of the profession and the program.
Good evening, everyone. Just so you know, all of your mics and cams for viewers will be turned off, so we will not be able to see you and we will not be able to hear you. The way we will communicate from this point on is through your chat box. So you want to make sure that you can type in your chat box for any type of question. If you have any questions, we'd like for you to wait until the presentation is completed. That way we can make sure that we answer everyone's question and we don't miss anything. If you have any questions, you can't hear us, or there's something wrong with your video, you want to go to the top to go to your tools, and then go to your video audio wizard to make sure that you can see and hear us. If you cannot, we will begin the presentation. If you can't hear us or see us, go to your audio wizard, and if you still can't hear or see us, please type in the chat box and we'll see if we can help you as soon as possible. Okay? Thank you.
Okay, so established in 1972, the George Washington University Physician Assistant Program is one of the oldest in the nation and is rich in tradition. The program's location in the nation's capital provides our students with unique opportunities, both academic and clinical, as well as exposure to diverse patient populations. Our program was one of the first to be sponsored by medical schools and continues to be housed in the School of Medicine and Health Sciences today. We are strongly committed to the vision and mission of our program and are looking for applicants who share these values. We envision our program to be a leader in PA education and believe our educational opportunities result in transformative experiences that inspire our students, our faculty, and alumni to become leaders committed to health for all individuals. We have an amazing faculty who collectively have over 150 years of PA education experience and 200 years in clinical practice. We are known leaders in the field, have served on various boards in PA education, in the profession and other organizations, and have even been recognized for our teaching. The George Washington University program has been continuously accredited by the Accreditation Review Commission since its establishment in 1972. And we are proud to say that we have graduated nearly 2,000 alumni and are looking forward to adding others to these ranks. To become a certified PA, Graduates must pass the Physician Assistant National Certifying Exam, otherwise known as PANCE. Over the past 5 years, 97% of our students have passed the exam on their first attempt. Our most recent cohort, which graduated in May of 2014, have either completed the exam or are scheduled to take the exam. And once we have the final passage rates, we will make those available on our website, as well as the national pass rates for all programs, first-time takers across the nation. So now I'm going to provide you with a brief overview of the profession. I know some of you are just beginning to learn about the PA profession. Others may have solidified their reasons for wanting to pursue this profession. So I'm just going to provide a brief overview of what PAs are and what we do. Physician assistants are healthcare providers who work with a supervising physician. They are nationally certified and licensed by their states and practice in various clinical settings. They are responsible for their duties that encompass many tasks, including but not limited to taking medical histories, performing physical exams, ordering and interpreting diagnostic studies, diagnosing illnesses, developing and implementing treatment plans, including prescribing medications. And currently, PAs are authorized to prescribe medications in 50 states, the District of Columbia, and all U.S. territories with the exception of Puerto Rico. PAs are an integral part of the healthcare system and an integral part of the healthcare team. The PA profession was founded in 1965 by Dr. Eugene Stead, the chair and professor of medicine at Duke University. The first PA program at Duke accepted 4 Navy medical corpsmen in a 2-year intensive medical program. And shortly thereafter, similar programs opened up in other medical centers, including our program here at George Washington University. Since 1965, the profession has grown substantially, and currently over 90,000 PAs are actively practicing in the United States. PAs are employed virtually in every type of practice setting in the healthcare system. They are working in single and multiple specialty group practices, solo private practices, hospitals, emergency departments, urgent care centers. They are working in rural health clinics, community health centers. They are employed by the U.S. Armed Forces and the VA health system. And in addition, they are working in industrial and occupational health systems as well. According to the Bureau of Labor Statistics, employment of PAs is expected to grow 38% from 2012 to 2022. Much faster than the average for all occupations. And why do you ask? Well, the reasons are multifactorial. First, there's an increased demand for healthcare services. We have a graying of our society, so our population is aging. There's widespread prevalence of chronic diseases, and all of these factors combined with the fact that there's a shortage of physicians. PAs practice in nearly every specialty, medical specialty, and subspecialty. This chart shows the mean annual income for PAs by specialty in 2013, based on data collected from the annual survey conducted by the American Academy of Physician Assistants. The mean salary across all practice settings, specialties, and years in practice in 2013 was $97,000. Other interesting facts that you might want to know is that approximately 65% of practicing with PAs are women, and the mean age is 42 years. So to talk a little bit more about our programs of study that we offer here, in order to sit for the entry-level exam into the profession, again, we spoke earlier about that. That is the Physician Assistant National Certifying Exam. You must graduate from an accredited PA program. At the time of this presentation, there are currently 187 accredited PA programs in the United States. Most programs range in length between 24 and 36 months and are composed of a didactic and a clinical component. And the average length of programs based on the data from 2011 and 2012 was 26 months. The GWPA program offers 2 degree programs, a 2-year program leading to a Master of Science in Health Science, and a 3-year program leading to a dual degree, including a Master of Science in Health Science and a Master of Public Health. The traditional 2-year PA program, which confers the degree of Master of Science in Health Science, includes 1 year of didactic or classroom study and 1 year of clinical practicum experience. I'm going to briefly give you an overview of the academic curriculum, but I must inform you at this time that we are in the process of redesigning our didactic curriculum. And while the course numbers and titles and even maybe the course sequencing may change, the content will remain the same. In the first 12 months that you study in the program, you will be engaged in basic sciences, behavioral, as well as clinical sciences. During your first semester, which starts in the summer, you will take several foundational science courses, including anatomy and biochemistry, as well as foundations of evidence-based practice, which focuses on research methods and statistics. You will also take a course entitled The Role of PA in the American Healthcare System, which is taught by a nationally renowned PA educator, Dr. James Cawley. In addition, you will take clinical assessment. That's an opportunity for you to learn how to obtain a medical history and perform a physical examination. And this course is very closely aligned with anatomy. Based on your anatomical knowledge, as well as the knowledge and skills that you acquire through clinical assessment, our curriculum is even more integrated with practical cases in a course called Integration into Clinical Concepts. In this particular course, you work in small groups which are facilitated by your faculty advisor. What's wonderful about this is that it provides an opportunity for your faculty advisor to see how you are developing professionally, and also allows the students to get to know their faculty advisor and hopefully build a bond that will continue for many, many years. The other course that's taken in the summer is Health, Justice, and Society. This is a 2-course series that takes place in the summer semester as well as the fall semester, and the focus of this particular course is patient advocacy and community service. In the fall, you're going to expand your basic science knowledge even more by taking courses in physiology, microbiology, and pathology. Then you'll start the first of the 2 clinical medicine courses, as well as a human behavior course, in which cover the psychiatric illnesses and behavioral counseling. And these organ system-based courses approach the pathophysiology, diagnosis, and treatment of many of the diseases that you will encounter in clinical practice. You will also be engaged in a course in pharmacology, which parallels the topics that are being covered in clinical medicine, so that you can learn about the appropriate pharmacologic approaches to disease management. In addition, you will take clinical skills. This is a 2-course series. You'll take part 1 in the fall, and the emphasis in clinical skills 1 is to teach you how to interpret EKGs and radiologic studies. Okay. Finally, in the spring, you'll complete the final clinical medicine course and take part 2 of pharmacology and pathology. In addition, you'll take clinical skills 2, and this is an opportunity for you to get the hands-on experiences where you're exposed to the technical procedures that PAs will be required to know how to perform both in their clinical year of the program as well as when they practice clinically after graduation. In addition, you will take the second iteration of the evidence-based practice course. However, in this version, it's not more necessarily theory-based, but it has more to do with applying the existing research into everyday clinical practice. And the integration into clinical concept course continues for the final semester. Beginning in the summer of the second year, students begin the clinical curriculum. This is when you have an opportunity to take all the knowledge and skills that you gained in your didactic year of training and apply it to patients on an everyday basis. During your clinical year, you will be involved in 8 clinical rotations, including an elective in a medical or surgical specialty or subspecialty. And all of our rotations are 6 weeks in length. The rotations are located in diverse clinical settings, including inpatient and outpatient settings, as well as urban, rural, and suburban settings as well. The MSHS NPH dual degree gives you the skills not only to practice medicine, but it also provides a broader context of population health. Currently, the MPH program at GW allows you to choose from several tracks of study. And while the default track is community-oriented primary care, there are other tracks that you can choose from, including health promotion and disease prevention, global health, maternal and child health, health policy, epidemiology, and environmental science. I recommend that if you're interested in learning more about these tracks, that you visit the Milken Institute School of Public Health website for more information. Presently, the PA-MPH includes the same PA curriculum that I talked about earlier with the MSHS program, but it's interdigitated with the 45-credit public health curriculum. So mainly in the first year, your main focus is on your public health courses, and you will take some basic science courses. Presently, students are taking biochemistry and physiology. During the second year, you're finishing up your public health courses, and there's a greater focus on your PA didactic courses. And then your third year, your focus is primarily on your clinical rotations. And I'm now going to open up the floor to Ms. McCann, who will talk to you about the application process.
Thank you, Dr. Wright. So we have a couple of admissions requirements to get into the GW Physician Assistant Program. The first is you have to have a bachelor's degree from a regionally accredited institution. Now, if you're an international student and you have a degree from an international institution, that's fine, but you will need to have it reviewed by one of our accrediting agencies. You can look online for many of the accrediting agencies we have on our website. You must have an undergraduate cumulative GPA of 3.0 and an overall science GPA of 3.0 as well. So if you add up all of your science courses that you took in your undergrad and that you took in your post-bac courses, it has to be at least a 3.0. You also must submit a GRE score within the last 5 years. So if you're looking at your GRE and you took it in 2008, unfortunately you'll have to retake the GRE to submit those courses. Our prerequisite courses we'll talk a little bit more about. And then, of course, you need direct patient care experience. And we'll also talk a little bit more about that as well. So the prerequisites. We require that you have 6 specific courses. These courses are 2 biological sciences. These can be any college-level biology courses. So you can take biology, you can take genetics, you can take microbiology. But we actually strongly recommend that you take anatomy and physiology. The reason is because you will be taking one of those courses, or even 2 of those courses, once you get to your campus. So it's best to have that kind of background information. We also require 2 chemistry courses. One of those chemistry courses must be organic or biochemistry. And then finally we require 2 psychology courses. Again, one must be introduction or general psychology. Again, we also suggest that you take abnormal psychology, but it's not required. You must receive a B- or better in these courses, and they must be taken from a regionally accredited institution. There's a couple things to remember about your prerequisites. You cannot have them from outside of the United States. They must be taken within the United States, and they must be taken as part of either undergraduate or post-grad. So let's say you got a master's degree in biology. You would not be able to use your master's degree for those prerequisite courses. Okay? You are allowed to you're allowed to apply to the program with at least 4 of the 6 courses. So if you have the biology and the chemistry courses, but you still need the psychology, you can still apply. But you must complete those 2 psychology courses by the time you are enrolled in the college, which is usually around April 30th when you get finally admitted. All right, prior healthcare experience. That's a big one for a lot of students. We require 1,000 hours of direct patient care experience. We are very, very stuck on 1,000 hours. So if you have let's say you have 999, you want to make sure that you have 1,000 before you apply. We will not review any applications that don't have 1,000 hours. And as I said, all hours must be completed by the time of your submission, and that application is submitted. So you want to make sure that once you submit, you have the hours, and not that, oh, well, I'm going to have some hours by the time I get to GW. It's not quite the case. You must have 1,000 hours. We consider direct patient care experience as experience that you're working with patients in a medical setting, and you're working hands-on with patients. You're taking the vitals, you're taking medical history. It can be such as medical scribe, it can be EMT paramedic. I mean, what was your direct patient care experience? Do you remember?
I was a medical assistant for orthopedic practice.
Okay. Dan?
I was a combat lifesaver in the Marines and in UT.
So there you go. Those are definitely 2 options that you could do. And we kind of leave it up to you. If you ever have any questions about what direct patient care experience could be, please feel free to send us an email. We also ask that you have at least 6 months of health-related experience. That would be experience such as working at a dentist's office or maybe working in the front office, or working as a medical transporter where you're moving patients from one place to the next. We also require that you have GRE scores, and they must be due by October 1st, our deadline. So you must send an official copy to GW, either by mail or electronically through ETS. Our code is 5246. I will tell you there is no secondary code, and there may not be a code for CASPA, so the important thing to do is that when you're taking your GRE scores, send them right through ETS or email them straight to us. So scores for this year must be from 2010 to 2014. So the application. There are 3 parts that you have to have for your application to be complete. The CASPA application, your GW supplemental application, and then your GRE scores. And each part of that has to be completed. So for your CASPA application, you want to submit all of your transcripts, 2 to 3 letters of recommendation, and then you want to have your GRE scores. If you haven't looked at CASPA, it's very important to look at it pretty quickly, especially if you're thinking about applying for this round, because the CASPA application requires you to put in every transcript and every class that you've ever taken, and that can be a bit of a burden, and it can take a very long time from you putting in your stuff to us actually getting your application. You also want to make sure that you do our GW supplemental application. We do not send it to students, it's on our website. And that gives us a little bit more idea of who you are and why you want to be at GW. The GW supplemental application does ask for a statement of purpose. And the question that we ask is, why is GW the right fit for you? Why is GW the correct PA school for you? Everything must be completed and received by October 1st. And that's really important because, as I said, you can submit your CASPA application on September 30th, but if we don't receive it until September 30th, but if we don't receive it until October 13th, then you're past the deadline. So it's really important to make sure that all of your materials are submitted to CASPA way before the deadline. The admissions process. The first part of the process is verification of prerequisites. So what will happen is your application comes through, I receive it, I make sure you have all the prerequisites, you have a B- or better, you're taken at a regionally accredited institution, you have your GRE scores, you have the GPA of 3.0 or above, and then from there, your application is, once it passes all of that, Your application is sent on to an independent committee for review. Now, your application is going to be reviewed maybe 2 or even 3 times, and it's by our admissions committee, which is all faculty members. And they're going to review your application to see what you really have and what kind of student you are, and what would you be a good fit to bring in for our interview. Then the third step is the invitation to interview. Now, I'll talk a little bit more about that, but our interviews happen in the fall, and we have 4 of them that happen in the fall. Once a student has come in, and let's say they get an interview, once the interviews are done, they're put back into the pool until the end when we have a chance to really review all the students. If you don't meet the minimum requirements, your application can be denied at that point. So it's really people say it's like a rolling admissions, and it's similar to that, but just keep in mind that not every student will get a decision within a month or 2 months of them putting in their application. Okay, so interviews. Interviews are in the fall from September to December. They're on Saturdays from 7:30 to 3:30. There are multiple interviews. And I will say, if you don't know what an MMI is, it's a good idea to kind of look it up online. These interviews, they're interesting. It's not like a traditional interview where you come in, sit down, and talk about yourself for 30 minutes. The MMI interviews, you will get 1 minute to read a prompt, and then 7 minutes to talk about that prompt, and then another minute to move to the next station. So they run pretty quickly. You also get a chance to have 2 panel discussions, one from the first-year students and then one from second-year students. So not only will you know about what students are doing in their didactic, but you'll also understand what's going on for students that are right in the middle of their rotations right now. And then you'll also get a campus tour as well. So you'll be able to see the campus and see how students are at, what rooms they go to, where do they stay. It's a really great opportunity to see around, see the GW campus. Okay, so I get questions a lot about what makes a competitive applicant. We're going to look at the 2016-2017 student profile. As you can see, our ages range from around, on average, 25 to 27. That does not mean, I want to remind everyone that these are averages. So that doesn't mean that everyone that's in this room, everyone that's in this class is 27 or 25. It can range anywhere from 21 to 62, you know? The science GPAs range around 3.5, and our overall GPAs range the same around 3.58 as well. Science credits mean, for the MSHS students, that they've taken about 65 hours of science credits. So you really want to make sure you're looking at yourself and comparing the average yourself to the average student that comes into GW. Our verbal percentile is about 81%, and our GRE quant is about 60%. The reason why we use percentiles is because the GRE has kind of switched their way of scoring, and so some scores are on a 800 scale and some scores are not, and so instead we just use percentiles so everyone can work on the same score. Okay. So what makes a competitive applicant? Well, it's important to remember, like I said, that all of these are averages. Some of the admitted students will have a 4.0 GPA and they'll have a minimum healthcare experience. Some students will have 10,000 hours of direct patient care experience and have maybe the minimum 3.0 GPA. It's really important to make sure that you're a well-rounded student and you have everything. You have leadership, you have community service, you have direct patient care experience, the GPA, the GRE. You just want to make sure that you have everything. And that's going to make you a really competitive student. Okay? Just remember that no one area outweighs the other. So you want to make sure that when you're putting your application, you're putting in everything. Another point I will say is that when you're sending in your CASP application, it should be the most perfect application you've ever sent in, because CASP will not allow you to change it. So you make sure you edit it, you looked over it 2 or 3 times to make sure it's the most perfect application you can put in. Okay? So we thank you for listening to us. We're going to now entertain questions. We have listed some websites that, in case you wanted to kind of look into, we have the PA program website, AAPA, PAEA. I'm sure you want to say some of these are.
American Academy of Physician Assistants, the Physician Assistant Education Association, the National Commission on Certification for Physician Assistants, and the Bureau of Labor Statistics.
Okay. So we're going to open it up for questions. You can all use your chat to send those questions. You can direct them at either me, Dr. Wright, or either of our students. Does anyone have any questions? You can go, keep off, you can go ahead and just type it out.
Here we go.
Here we go. All right, first question. Kristen would like to know, are there any scholarships available for PA students?
We do offer some scholarships. They're very limited and usually based on merit and some based on need. And yes, so we do offer some to students, incoming students to come to the program.
Scholarships are very limited, so I would not count on making sure you're saying I wouldn't count on getting a scholarship necessarily because they are very limited and very, very competitive. We do have options of financial aid, which comes in the form of loans, and you're welcome to go to the financial aid website to kind of look over some of the options for that. Okay. Our next question is from, I think it's Ms. Voss. Science credits include planned or in progress, and it is the same as the CAFA science hours, which I don't think include math or computer science. Okay, this is a great question. So science hours on CAFA does not include math or computer science. And what they are, science hours really are biology, physics, chemistry, and they also include something called other science, which can include some things like nursing classes and other things like that. The best thing you can do is go online to CAFA, and they actually tell you what classes they include in their science credits. Okay. I hope that answers your question. If not, you're welcome to write back in. Amy Gomez wants to know, can you do your clinical rotations locally, or can you leave the area?
Yes, you have an opportunity to do rotations locally or outside of the district. The only stipulation that we have is that there has to be an affiliation agreement in place, and you have to be in good academic standing.
Does anyone else have any questions? Dr. Ray, what are the opportunities for veteran applicants in regards to admissions considerations?
Well, we take that into consideration with regard to match submission. So a veteran is an ideal candidate. I don't know if you want to add anything else to that, Mr. Brown.
James, I'm also a veteran. We have a significant amount in the current class in the didactic year right now. I believe there's 11, and I believe that's more than any we've had before. So the trend is going up, and if you're worried about finance or anything like that, the GI Bill and the Elderly program are covering my tuition 100% completely. So it's a great deal to come here.
Thank you, James. Is there any other questions?
No problem.
So the question Amy has is regarding healthcare experience. Can medical or pharmaceutical sales be considered?
No, that is not direct patient care.
Right. The reason why really is because you have, like I said, you have to be working with patients. Not necessarily the doctor, you have to be working with patients.
She's saying that it could be that she's actually selling the equipment directly to patients, but that's not considered direct patient.
Right. You still have to be doing something in almost in a medical setting. I mean, that is okay.
It's got to be hands-on.
Yeah. Amy, it has to really be hands-on. I mean, you really want to be doing something like I said, taking medical history, taking vitals, something like, is it phlebotomy? I always said that incorrectly, phlebotomy, where you're taking blood. It really has to be more hands-on with the patient specifically. Okay. If you already are a pharmaceutical sales or your medical sales, that's fine. What you want to start doing at this point is looking into something that does give you a little bit more hands-on opportunity. So I always tell students to start looking into volunteer options. It might take a while. We're not going to say that this is an easy thing to undertake. It might take a while to create a connection and become like a medical assistant or a nurse's aide. It might take a while to make that connection and do the time that you need to get the 1,000 hours, but that's going to prepare you when you come in and you already have that background knowledge working as a PA.
What route did you use to become a medical assistant?
I was actually working in the practice in a bunch of different positions, and I had always shown interest in wanting to have direct patient care. And so the nice thing about the office I worked in was that they trained the employees who wanted to be medical assistants on site, and they had to go through that process in the office. So it was nice. I started as a receptionist, did the bookkeeping for the office, and then ended up, because I showed interest, doing the medical assistant position. So you might be able to find with your pharmaceutical or medical sales position the contacts that you've made with different medical offices. You might be able to inquire about if they have positions opening that you might be able to step into because you've already had that point of contact.
Okay.
Kristen wants to know, would medical service trips that are outside of the United States be considered clinical hours? Yes, we do consider international hours. It does not have to be within the United States. It can be when you go away and do a service trip, again, but it still has to, you can't, so in other words, if you did a service trip in Guatemala where you're building a hospital or helping to build a part of a hospital, that's just building. It has to be working with patients. Okay? Okay. You're welcome, Amy. If you're welcome, you don't have to raise your hand. You can just go ahead and type in a question, and we'll make sure we catch all the questions that people write down.
Coaches got a question.
Okay. So for these specific questions about direct patient care, I would say to email us, because the problem with this setup here is that we don't know what your actual duties are as a nuclear med tech. So some students as a nuclear med tech are just working in the lab. Other students would be working with patients. So you want to make sure that if it's something specific to a position that you have right now, go ahead and send us an email, and I can type out my email for everyone. And that way we can kind of sit down, you can say what your duties are, and then we can decide if it's direct patient care. All right. James says, no problem. Okay, so James wants to know, is there any part of the application process that will automatically disqualify you from getting your app read to the admissions committee? Yes, there are. If you do not have the 3.0 GPA, if you have a 2.9, even if you have a 2.99, that will disqualify you. If you do not complete, if you have more than 2 outstanding prerequisites, that will also disqualify you. If you do not have 1,000 hours of direct patient care experience, that also will disqualify you. If you do not complete a supplemental, that will disqualify you. If you do not send in your GRE scores, that will disqualify you. So it's not necessarily, those are requirements. If you do not meet our requirements, unfortunately those will disqualify you from moving on to the application process. But if you have a lower GRE score, that in no way will stop you from moving on to the next part. It will no way stop you from moving on to the admissions committee. As I said before, those are averages. You know, our GRE percentiles are averages. Do we have students that have come in with maybe a 40 percentile GRE? Yes. You know, so it really just depends on what you have else in your background to kind of consider or bring in everything. Even though you have maybe a lower GRE score.
We'll look at you holistically to see, because it could be that you have a very strong healthcare background, that you perform very well in your science courses and things of that nature. So we take all that into consideration.
Yes, it will be possible to get a recorded version of this webinar. It will be on the GW website. The same place that you logged in to reserve a spot for this webinar will be the same place where you can find a recorded version. We probably won't be able to get it up until Tuesday because of the holiday. You're welcome. Is there any other questions? So first I'd like to know how many applications did we receive last year, and of those, how many were offered interviews and then ultimately accepted? Okay, we received over 1,400 applications last year. We offered 240 interviews, and we now have a class of 68. So it's competitive. You're welcome. Did anyone have any questions for us? Oh, how many PAs versus MPH students? So it's about...
Well, the current class, the class is going to graduate in 2016. There are 13 MPH students and the rest, 55 MSHS students. And the class that's going to graduate in 2017, we accepted 15 MPH students.
As far as for clinical rotations, ambulatory care medicine, can we elaborate on that?
That's more like in an outpatient care setting. It could be that you're working in a family practice office, or you're working in a some type of outpatient clinic. Could be sometimes it's even like an urgent care clinic, but it's definitely not in an inpatient setting.
How are students matched with a faculty advisor?
So, I've done that now for the past 2 years. I've matched the students with their faculty advisors. I take everything into consideration. I want to make sure there's a good balance of MSHS and dual students. I look at your health backgrounds because I want to make sure that the group is composed of students with varying healthcare backgrounds. I take things into consideration like age. I just try to make sure that it's a well-rounded group. And I've been told by the faculty that, at least for the last 2 years, I've done a pretty good job. I know you can ask the students.
Can you guys talk about your faculty advisors?
Yeah, I really enjoy the integration setting because you get to, like Dr. Wright said, is that you have other students that are in your setting that have a lot to offer, and things that I didn't experience or things that I didn't know about. And my faculty advisor is Professor Strauss, and it's excellent to have that dynamic. You have the students asking questions, and then the professor being able to give you real-world examples on how to solve problems, and I found it to be very helpful. What do you think, Dan?
I kind of enjoyed the breadth and depth of experience that was within my integration group. I have Professor Dunphy as my advisor, and she's reached out to all of us in our group and just talks about how we're doing the program as well, and make sure that there's a link between the faculty and the students. And they're really interested in making sure that we're all going to get through and do well. So it's a great experience in integration and with our faculty advisor, and it all kind of pans out.
How many integration students are in your group?
We have 6. So.
Okay, so it's a small. It's a small group of students. Okay. Are there any other questions? No.
No, he does. We have a few that have
question.
Okay, we have a few students that are married and have families and are doing pretty well with balancing young kids and older kids and schoolwork. So it's tough, but it's definitely possible.
And we're actually working on this year creating a program that will allow the spouses of our current students to kind of come together and create almost like a support group for each other, so they know each other, they know what's going on. It'll just help out students that have significant others.
Students that have families, it can be a major adjustment, especially depending on how young they are. I know that I've had an advisee that had a young infant when she, toddler when she entered the program, and it was a balancing act, and we had to come up with different strategies about what worked best for her with regard to spending some time with her family and then having that dedicated time to study. I find in many cases that students that have families actually are pretty good at time management, and so they know how to use their time well. And so you definitely can thrive. It's just going to be a matter of trying to find that right balance so that you can dedicate time, because it's a very rigorous program. There's no doubt. I think the students will tell you, although they've only completed one semester, it is a very rigorous program, but it's definitely doable. And I do believe that students with young children can prosper just as well as students without children.
You'll find time management skills immediately. It's kind of one of those things where you have to do it in order to survive.
And also the classmates, when we do things outside of the classroom, we also invite families over. So that helps in terms of creating your little group of people that will support you. So it's a nice environment.
And that leads into our next question, which is, even though it's a 2-year program, are students involved in other student and/or university groups? So do students have, and the other question is, do students have time outside of classwork and clinical rotation? So really, how is you guys' life outside of GW? Or within GW? Dan, do you want to go first?
I try to keep Saturdays holy, so I don't like to touch a book or anything like that, because I'm married and I like to give my wife attention as well. So we'll usually go out and do something, but usually Sundays are usually there for prep for the week. But usually you got to have one day where it's off. You just turn off the switch. But outside of class, there's plenty of stuff to do in DC. I've been to a couple of Nats games. There's no shortage of museums to see and do, and there's a lot of great restaurants and stuff. So it's a great place for family.
It's just going to take you time to make the adjustments, because some people don't need a lot of time dedicated to their studies. Others struggle, and it can sometimes be very frustrating because they need a lot of time to try to prepare for exams, where somebody else, depending on their study techniques, it doesn't take them very much time to master the material. So I do believe that it's very important for you to have time dedicated to do things outside of the program. But again, I reiterate, this is a very rigorous program, and a lot of time will be dedicated to studying and preparing for your classes.
Okay. So do students have time outside of classwork and clinical rotation? So we kind of talked a little bit about that. They do. For clinical rotation specifically, it's really more about your schedule. So even though we set you up with a rotation, once you get there to that hospital, we don't set you up with your schedule. So that schedule is up to you and whoever your supervisor is at that hospital or at that care provider. So you may be working weekends, you may be not working weekends, you may be working weekends. It's really up to you, and it's really up to your supervisor and how you guys work out your schedule. So it's really dependent on what rotation you get and where the rotation is and things like that.
It may vary. You may have a surgery rotation where you are there 60 hours per week, and then you follow up with perhaps maybe a family practice or some type of ambulatory clinic where you're just putting in 40 hours a week. So over the course of the year, it's kind of balanced, but it will vary from rotation to rotation and setting.
Okay. So one of the questions is, have we noticed older students or younger students tend to struggle more over the years? I haven't found, I don't think it's more of an age thing. I specifically think it's more of a person thing. It depends on how the person deals with it. If a person has already their study skills and, like we said before, time management skills, that plays a huge part rather than a student coming in who does not have those skills at all. So it really just matters the background of the student. You can have older students and younger students that have that time management background and will come in and just, it will still be difficult, but they can work through it. And then you'll have students that come in that aren't used to this type of rigor, and it gets a little bit tougher for them.
One thing that's really important about GW is that you take a test in terms of how you best learn. So they tell you coming in what type of a learner you are, if you're visual, you're auditory, you're kinesthetic, and that helps because for those students that may not have already created those time management skills, then you can hone in on how you best can grasp the material so you can make your time more effective. So it is rigorous, but it's something that with time and perseverance you can definitely do and achieve, and it's something that is a positive challenge instead of something to look at as something that you can't do, per se.
Celine is referring to the VARC. So if you want to Google VARC, and it'll ask you a series of questions about how you deal with certain situations, it will be able to determine what type of learner you are. Unfortunately for me, I'm a read-write, so I have to read everything and write everything. And so that's very time-consuming, so that means I have to manage my time really, really well.
I'm very auditory, and I also have to write. So there's a great program here at the school where all the lectures are actually recorded and synced up with PowerPoint presentations, so you can go back through and listen, and I'll take notes over and over and over again until it sinks in. But and you can adjust the speed on it so that you can save some time and get a little more efficient. It's a great learning tool.
So the next question is, how does the PA program work for international students in terms of acceptance rate into the program, able to go through it successfully? We actually have an international student in our class, our Didactic class right now. She is from Korea. Really, it's a matter of what you can be as a international student in the PA program. We're not stopping any international students from applying. We actually encourage it. Important things to keep in mind is citizenship, and if you have a visa, if you have a work visa or a school visa. It really depends. That's more specific. But I would say for acceptance rate, it just depends on how many students apply and how many students go through the process and have all the prerequisites ready to go. But if you have all of that, and you pretty much are we look at you in the sense of you do bring some type of some diversity to our group, which is fantastic. But overall, it's another student. We will help you try and get through for visas, and we know the process can be very daunting, and I helped that one student that we had bit by bit and step by step, but we look at it almost every other student. So.
The question James is asking is, do most students find jobs before graduation? I would say that when you're on your clinical rotations, that's an opportunity. That's for your preceptor to see you working. They're looking at your work ethic, they're looking at your interests, they're looking at your clinical skills. We have many students that will tell us that their preceptor wants to hire them after they sit for the boards and successfully pass them. So you can find a job before you graduate. Just remember that you have to also pass the boards, and you will get employed. The employment rate is very high. It doesn't take long for you to find a job. Our graduates are highly regarded, and I think if you had an opportunity, if we had alumni here, you will realize that they do not find it very difficult to find jobs after they leave the program.
I will also say that not a day goes by that we don't get a request for a GWPA. You know, oh, we have an opening in our surgery department. Do you have any GWPAs that might be interested in Texas? Or do you have any GWPAs that are in Vermont? We get them every day, and not only do we get them, but we then send them out to our students. So we have listservs that you stay on as an alumni, and let's say you want to change up jobs, you're going to get maybe 2 or 3 requests for GWPAs. So they're definitely in high demand. Okay. Our question is, what are some of the most imperative yearly PA meetings to attend each year? Oh, do you mean, Amy, I'm sorry, do you mean like conferences? Yeah, okay, great. Do you guys gone to any conferences? You guys lived at that time.
I haven't been able to go to the conferences, but GW is really good about working with students and fundraising to get students to go. And they make time in the schedule in terms of the didactic and the clinical year to allow time. Unfortunately, last year I wasn't able to go, but the students that did go this year had a fantastic time in Boston. They were there presenting about what we did as a student body at the Tolton Society, and then also representing the program and interacting with other students and PAs that are working in the field. So it was something that people really like to do, and you can definitely get the support that you might need to get there.
So what are those organizations?
That's usually the AAPA, American Academy of Physicians Assistants.
Yeah, that happens annually in May.
Memorial Day?
Right around that time.
Right around Memorial Day. And if you want to learn more about it, you could go to the AAPA website. And hopefully we'll have a Tolton Society website soon so that future students can look at it and find out more about getting involved with those types of activities and being able to go to the conference and see what that's actually like. So hopefully that'll be coming soon so that you can access that.
Next question is preference given to students who live in DC area in regards to admissions? No. That's a very easy answer, no. We were literally just talking about how we have a varied amount of students from different parts of this country. I don't even know, sometimes we do have students from DC, Maryland, Virginia, sometimes we don't. It really just depends on who gets in that year. Where are you from?
I'm from Oregon, right near Portland. It's a suburb of Portland, and Dan is from?
I'm originally from Manassas, Virginia, but I applied when I was in North Carolina. And I did a survey recently as part of our admissions presentation of where everyone's from, and it's kind of an even spread across all the regions of the country.
Does anyone have any other questions?
Oh, big one.
Okay, for the international student, it's, even though you're getting your undergrad degree from the state, it doesn't necessarily give you an advantage, and it doesn't necessarily give you any aid in getting accepted. Because when students get their degree from other countries, what we do is we get them to review them by usually an accrediting agency, and that accrediting agency will review your transcript, and they pretty much correlate it to what it would be if it was a United States transcript or American transcript. So it doesn't really give you any advantage or disadvantage. I will say if you are a U.S. citizen, it does give you an advantage for financial aid, because U.S. citizens do have the opportunity to get federal aid, whereas students that are not international students unfortunately do not get that opportunity to get the federal aid. No problem. Thank you. So we'll just wrap up. We have plenty of time, but if anyone has any other final questions? Oh. So really the question is there hands-on experience that is more favorable or less favorable? I will leave it up to our faculty member.
No, we're looking at the quality of the experience and the number of hours that you've done. So if you actually were volunteering and you have over 5,000 hours of direct patient care, and somebody else was maybe an LPN or an RN but only has 1,000 hours, it kind of balances itself out. The important thing is that we're looking for direct patient care, because we're looking to see if the students are going to, it demonstrates if they're going to have a hard time practicing in the clinical setting. And that's why most PA programs are looking for students to do direct patient care. So we get this question all the time, if one rated more higher more highly than the other, and it truly is a balancing act. It could be that you were an RN and have over 5,000 hours. That's great, and so that person's direct patient care may be stronger than somebody else that may have just volunteered with and they just barely got 1,000 hours. But the important takeaway here is to make sure that you get the direct patient care, because the other things are going to help. You may be lacking in the direct patient care. I mean, as long as you met the criteria. So then we're looking at the other areas. You know, how strong is your science GPA? How what are your leadership skills? Have you demonstrated leadership? What is your community service? Our mission and vision is very much centered around community service. And so if you've done hundreds of hours in community service, they start to weigh each other out. So we look at you holistically. We look at you, based on all aspects.
So yes, there is a minimum GPA that as soon as you have, it is 3.0. And the question is the higher the GPA, the better? Not necessarily. I mean, you can have a student that only took 6 science courses and got a 4.0 in those 6 science courses. That's great, but you only took 6 science courses, and that's just not enough, So you really have to make sure that you're looking at the whole package. So, like I said, there are students that have maybe the minimum GPA of a 3.0 and have, tons of hours or community service or have this. And then there might be students that have a 4.0, but then, they might have less hours. So it really just depends, but we are looking for students that are strong academically and strong in experience and volunteer. We're looking for a very strong student. And the reason why we're really stressing this is because you have to be a strong student, because once you get here, it's a tough program. And we want you to succeed, and we want you to already have the skills so that when you get here, you can succeed. No problem. Thank you guys so much. Oh, one more question. For current students, what led you to choose, oh no, it's fine, Kristen. What led you to choose to attend GW rather than any other programs you may have been admitted to? That's a great question.
You go first.
So I applied to a lot of programs, and I would highly encourage you to apply to GW. It's a fantastic program. The interviews that I went on, GW really spoke to me. The MMIs, I really enjoyed that. Of all the different formats of the interviews that I've had at other places, written interviews, group interviews, things like that, the MMI I felt gave me a really fair chance. It was 10 people that were able to get a first impression of me instead of one person in one room, or by writing something on a table, for 30 minutes with a question. So I really liked the interview format, and I really felt comfortable when I came to the campus and discussed with students and faculty on interview day. And then the mission was very important to me in terms of commitment to your community and diversity and the excellence of education. I've really enjoyed my time here, and I guess the thing that I would stress to you is that through your interview process, you're going to find the program that speaks to you and fits you as an individual, and I just would encourage you to try and not limit yourself.
I applied to 9 different programs. And I got to say, I did not get an interview for all of them, but I would say that of the interviews I did get, this was my best experience. I really enjoyed the NMI. I really enjoyed the campus and all the facilities that are here, that are all in the city. Just the district itself is a great place to be. The faculty are outstanding. The students that you're going to run into are outstanding. It's a really great it's just a really great experience and a great time to be here. So I really think that, absolutely go and seek out the programs and weigh them against what you have here, and make a choice as to what fits you the best.
Thank you, Dan. Because when you come to interview with us, we're looking to see if you're going to be a good fit for us. And you should be doing the same. When you come, we're being looked at to see if we're a good fit for you. So you have to take that into consideration. So if you are fortunate enough to be offered an interview and you come, you need to take that into consideration when you come. If you don't feel comfortable, you don't like the way the classes are, the curriculum is set up. Some people do better in a certain type of curriculum over others. You have to take all that into consideration.
Any other questions? You're welcome. I think we'll take final questions. If anyone has any other questions? Okay, I think that's it then. Oh, are there after-hour access to facilities and labs? Yes. Right? Correct?
Yes. The clinical assessment lab is you can schedule it on your own and go in there with a partner and practice for your head-to-toe exam, which Celine is actually my head-to-toe partner. Yeah.
Wow.
For our actual assessment there, and it's you need to do that and go over it a lot with someone else. So it's good to practice and have that facility there available.
I did not know that when I
All right, thank you, Jean. So as I said before, we really appreciate you all listening in. This will be posted probably sometime next week on our website if you want to review it or have any other questions. It'll also, at the end of the presentation, have my name and my email address if you have any further personal admissions questions that you wanted to go through. At this time, I don't take one-on-one sessions, but please feel free to give me a call or send me an email. I will always try and get back to you within 24 hours. So thank you so much. We really appreciate you being a part of our webinar, and have a great night. Thank you.